Hello everyone. So in this video we are going to talk about Down syndrome, that is trisomy of 21st chromosome. As you see in this image, we have three copies of the 21st chromosome rather than the two, that is leading to Down syndrome. Now there are two causes mainly for this Down syndrome. The first one, which leads to 95% of cases, is meiotic non-disjunction of chromosomes. The second one, that leads to 4% of cases, is Robertsonian translocation. So now we will talk about the characteristic facies that is seen in Down syndrome. The first feature we are going to talk about is the mongoloid slant, or the upslanting eyes that are seen in this case. That is, the palpebral fissure is actually oblique, shown by these yellow lines. The second feature is the epicanthal folds. That is, on the medial side we see a skin fold that is not usually present in everyone. The third feature is the low set ears. Now from the lateral angle of eye, when we draw a perpendicular line behind, the ears lie below these lines, which are known as the low set ears. The third feature is a protruding tongue. That is, because of a small mandible, the tongue appears to have macroglossia. Okay, and the final features that we must remember also along with these features are the brachycephaly, the flat facies in this case, the child has a low IQ, and overall the child also has hypotonia. Another feature is the white spots on the iris, that is known as brushfield spots. Now let's sum it all, the facies in a baby of Down syndrome. So this image shows it all: a baby with a protruding tongue, the flat facies, the brachycephaly or the microcephaly, and the other features like the nose that is short, and the smooth philtrum, and a mongoloid slant. So the next feature is what we see in hand, that is, compared to a normal crease on hand, there is a single transverse crease, okay, that we are seeing on the right side, that is known as Simeon's crease. On the foot, what we see is a large gap between the big toe and the next second toe, that is what is known as Sandal's gap. Talking about the internal malformations that are seen in a baby of Down syndrome, the first one is seen in 50% of cases is congenital heart disease, and most commonly this is because of loss of endocardial cushion that leads to a atrioventricular septal defect, as we see clearly in the right image. The second thing we are going to study is the defects that are because of the malformations in GIT. The first one is the duodenal atresia, which is most common GIT malformation. As we see in this image, there is a blind sac above that leads to a distended duodenum and a distended abdomen, and here we see a site of atresia between the duodenum and the next part of the duodenum. The other features are the annular pancreas and the Hirschsprung's disease. The next thing we need to know are the tumors in the case of Down syndrome. The most common being the acute lymphoblastic leukemia, but please note, in a baby less than 3 years of age, AML M7 type is more common than ALL. This is what we needed to know about a bit of Down syndrome. So thanks for watching.